internal base. Okay. Next up is a pretty simple opening we call foramen rotundum. This is the horizontal foramen, isn't it? You remember that? If we turn the skull and see the end of the, do you see the shining of the needle there? I do. Do you? I can.
My fault. No.
Right there.
Yeah.
You see that? I'm going to move it a little. So where did we end up?
Fossa pterygopalatina.
It's fossa pterygopalatina, and in fact we have nervus maxillaris that will go through the top part of fossa pterygopalatina in order to continue. Of course, I'm not going to be able to bend the needle like that, but it will continue into the orbit through fissura orbitalis inferior into sulcus infraorbitalis and canalis and so on. Okay, so that's the major pathway horizontally anterior. That is nervus maxillaris. Of course, nervus maxillaris, this is one of the end branches, that continues its pathway. Now we have the third big opening for the third division, the foramen ovale, communicating with fossa infratemporalis. Small detail, fossa infratemporalis can only be imagined if we have the mandible on the skull, because this area here, where I have the needle right there, is fossa infratemporalis, this area here. So my fingers now want to fill up the two fossae right here. That means that the lateral wall of fossa infratemporalis is the ramus of the mandible, and this makes one of the communications pretty easy to understand. This is canalis mandibulae, lingula and canalis mandibulae, the entry of nervus alveolaris inferior, one of the communications of fossa infratemporalis inside into the mandibular canal. Nervus alveolaris inferior, that will eventually exit through foramen mentale and nervus mentalis, and thus we will supply the entire inferior dental arch. Good. There is also another communication, if you think about it. We have, damn, they don't match. So we do have right here, position it like so, this, or from lateral please, here. What is this, people? Incisura mandibulae. What do you think this house is? What is this communication?
Nervus massetericus.
Exactly. So we have the masseter muscle right here, directed like my finger here, isn't it? And it needs innervation and vascular supply. So all of it comes from fossa infratemporalis through or via incisura mandibulae, arteria masseterica, nervus massetericus. Yes? Both of them come through this. This is another lateral communication of fossa infratemporalis. Good. Now, let's get back to the next opening. We call this foramen. Damn, I can't get it. Foramen spinosum. Foramen spinosum is pretty simple. It has arteria meningia media. The proof is sulcus arteria meningia media. It starts right here, and it will eventually supply the entire internal surface. Also with nervus meningeus recurrens. That's a recurrent branch from the mandibular nerve that supplies the meninges, the dura mater, in fact, of the fossa crani media. Okay, what is this here? It's not a communication, it's just a question. Right here and right there. What is that? Do you remember? I'm going to tell you something, a hint. It's right at the apex of pars petrosa anterior surface. No? It's at the apex, at the tip of the anterior surface, pars petrosa. Like, it's located like here, it's right anterior. No, it's not an opening. It's impressio trigemini. Exactly. So this is the location of the Gasser ganglion, of the ganglion trigeminale, that will eventually give us the three branches all the way to their communication openings. Good. Okay. right here. Do you see that? I don't. Right here, I can see it better. Do you see anything there? The tip of the needle stopped, so it means that we have to have something there.
Hiatus nervi petrosi.
It is in fact exactly like she said, hiatus canalis nervi petrosi majoris and minoris. Yes? So let's just remember something. What are these? Last year, you just had to know that this is an opening that comes from the pars petrosa, isn't it? It is continued by sulcus nervi petrosi majoris, right here, and minoris. And as you can see, both of them go anteriorly in order to penetrate this opening we call, exactly, foramen lacerum, that goes in fossa infratemporalis. In a living skull, this opening is not an opening, you know that. In a living skull, this opening is completely closed by a cartilage. And the thin nerves that we talk about here, we talk about petrosus major, minor, and profundus, all of them are embedded in this cartilage and are supported by this cartilage. And they combine with each other here. So, where does nervus petrosus major come from? Where does nervus petrosus minor come from? In order to reach their openings here. One person, yes. Exactly, more exactly. Yeah, I can accept nervus intermedius, but can tell me some more detail.
It's not gonna go to ganglion geniculatum, but it's gonna
It's at the level of ganglion geniculi that goes exactly, detaches here and goes into its own canal inside pars petrosa in order to exit here. What does it contain? What type of fibers does it contain? Nervus petrosus major. Please? Parasympathetic preganglionic fibers from nucleus salivatorius superior. These fibers are headed towards ganglion. These fibers are headed towards ganglion pterygopalatinum, to synapse there. These fibers make ganglion pterygopalatinum a parasympathetic ganglion. Yes? They reach ganglion pterygopalatinum by first going into sulcus nervi petrosi majoris, then going through the cartilage of foramen lacerum. In order to reach this opening here, we call canalis pterygoideus. Here, they combine with the fibers of nervus petrosus profundus. That is a what kind of nerve? Sympathetic fibers, pre or post ganglionic. Where are the cell bodies if it's post ganglionic? Ganglion cervicalis superius. Then those post-ganglionic fibers organize themselves into plexus caroticus internus, coming together with arteria carotis interna or around it. And then just before this artery enters, they will detach and combine with nervus petrosus major into nervus canalis pterygoidei, and together with arteria canalis pterygoidei, so that we have a complete information here, they will end up in, this didn't end up there, in fossa pterygopalatina, the top part of it. What surface of what bone? Do you understand the question? So canalis pterygoideus has two openings, a posterior opening and an anterior opening. We see the posterior opening that it's right between the two pterygoid plates at their root. That's the posterior opening. You can see that. The anterior opening is in fossa pterygopalatina on which bones, which surface? Not palatinum, not zygomaticum, not maxilla. Maxilla is anterior to fossa pterygopalatina, no? Of course, it has to be. It passes, this tunnel passes the root of the pterygoid processes. So if it passes, it enters here posteriorly, then anteriorly it will still come out as part of the sphenoid bone, but this time we consider it ala major facies maxillaris, as I told you that's the inside surface. Facies sphenomaxillaris of the ala major has two openings, one top of each other. You remember that. The superior opening is foramen rotundum for nervus maxillaris, and the inferior opening is foramen canalis pterygoidei, so to speak, or canalis pterygoideus, just like that, for the nerve itself, nervus canalis pterygoidei. Okay? It's very simple. Good. So we just talked about the pathway of these fibers, both sympathetic and parasympathetic, to ganglion pterygopalatinum. So we mentioned two roots of ganglion pterygopalatinum, the sympathetic and parasympathetic roots here. Okay. Now, what about nervus petrosus minor?
Comes from glossopharyngeals.
Well, not directly.
No.
So I can accept glossopharyngeals, but not directly.
Nervus tympanicus.
So nervus tympanicus of Jacobson, yes. Okay, continue, please.
It's gonna meet ganglion tympanicus inside the canalis tympanicus.
So the pathway is canaliculus tympanicus. Good. Where is canaliculus tympanicus? Do you remember anything about canaliculus tympanicus? No. Do you remember anything about fossula petrosa?
Yes.
Where is fossula petrosa?
Is it between canale carotide and jugulare?
Something like that. So it's, by definition, it's between canalis caroticus and foramen jugulare. Yes, so it's this area here, or right there. And this should be canaliculus tympanicus, or otherwise we have another one, cochleae. Yes, canaliculus tympanicus, canaliculus cochleae. Canaliculus cochleae is in fact an opening for the perilymph to drain. So it's a aqueduct, in fact. Okay, while tympanicus is a nervous tunnel that contains nervus tympanicus. So nervus tympanicus will go into the tympanic cavity to form plexus tympanicus, and from there nervi carotico-tympanici also, but we are talking about now about nervus petrosus minor that will eventually exit through hiatus canalis nervi petrosi minoris, sulcus nervi petrosi minoris, and foramen lacerum. Sorry? Or spinosus, right, in order to
From ganglion oticum.
reach ganglion oticum. And this will be, in fact, what? Synapsing preganglionic neurons, axons, coming from nucleus inferior, and then innervating by postganglionar fibers from the otic ganglion, the parotid gland via auriculotemporal nerve. Exactly. Good. What else? Do we have anything else here? I don't recall anything else. Good. Let's move on. So fossa crani posterior. People, you're losing focus. Fossa crani posterior. So, of course, the big